Hello ma'am, my name is Christine Mitalang and I'm from BSN2 of the College of Mount Carmel, and today I'm going to do a return demonstration on a proper way of doing the Leopold's maneuver. So let's get started. So before we even start with the procedure, let us go ahead and define what is a Leopold's maneuver. So Leopold's maneuver is a series of distinct maneuvers that is being used to determine the fetus presentation and at the same time position, of course, in the uterus. We also normally use this to check for the baby's weight. So there are four distinct types of maneuver. We have the fundal grip, we also have the umbilical grip, and at the same time we have the colic, and lastly the pelvic grip. So in doing the procedure, of course, it is necessary for us to first make sure that we prepare all the equipments that we need before we even go to the patient's room. We need a small pillow. We also need a towel to cover the patient. We also need a stethoscope, okay, to auscultate the patient's heart. I mean the fundal heart later on. And then after that, we also make sure that we provide privacy for the patient. Okay, so we close the door or we close the screen if needed so. And then after that, we make sure that we identify ourselves to the patient and make sure that we also identify or verify the patient's information. Hello ma'am, my name is Christine. I'll be your student nurse for today. Can I have your name please? Thank you. Can I please have your date of birth? Thank you so much. So by the way ma'am, today we'll be performing a Leopold's maneuver. So again, this is normally performed for us to determine the position and at the same time the presentation of your baby in your womb. So this is very necessary for us to identify, of course, the fetal line presentation of your baby. And maybe needing to expose your abdomen or your belly while doing the procedure. Is that okay with you ma'am? Thank you so much. So after explaining the procedure to the patient, before even doing the procedure, of course, you have to do hand washing. So let's do hand washing. Now I am done doing hand washing, but of course before even doing that, while doing the hand washing, instruct the patient to empty her bladder to make sure that she will feel comfortable all throughout the procedure. We also make sure that we position the patient comfortably on the bed. And then lastly, we make sure that we drape the patient to make sure, of course, that she will feel more comfortable while doing the procedure. Okay, and then after that, we also compute for the obstetric score, the age of gestation, and at the same time, the expected date of delivery of the mother. So after that, of course, you formulate our nursing diagnosis. For now, our nursing diagnosis is risk for injury related to mechanical obstruction of fetal descent, and of course, what we would like to, what the outcome that we would like to have after this procedure is to make sure that the patient will, of course, remain free from infection after the procedure. So we are now ready to do the first maneuver. So let us now do the first maneuver. So of course, the first thing we'll have to do is to make sure that we position the patient comfortably. We of course expose the belly of the mother. So mami, expose ko lang po yung belly ninyo. Okay, and then after that, we make sure that we are positioned as well, right to the patient. So for the first maneuver, we make sure that we face the mother. Okay, in this position, and after that, after facing the mother, we then palpate the uterine fundus, so which is this part. Okay, and at the same time, we try to distinguish which side of the uterus is the long axis of the baby. Okay, so normally the first maneuver is being done to identify fetal presentation and fetal lie. So in here, we are going to identify if the baby is on a breech position or on a cephalic position. So we can say that the baby is on a breech position if you can feel the head, which is of course moving. It's hard. And we can see that it's on a cephalic position if you can feel the buttocks, which is of course it's soft and it's round. Okay, now so let's go ahead and do the procedure. So again, we create like a triangle part, and then we try to palpate the fundus. We observe, we try to observe if we are feeling like a head or a buttocks. After doing the first maneuver, we are now ready to do the umbilical grip, which is the second maneuver. So in doing the second maneuver, basically what we are going to do is to find the fetal back for us to identify on which location should we palpate or should we auscultate the fetal's heart. Okay, so of course, we will position ourselves the same position as what we had a while ago, so facing the mother. And then using the palmar surface of our hands, we go ahead and put it on the side of the abdomen, and then we make sure to apply a deep but gentle pressure. And then after that, we palpate the other side using, of course, the other side using our hand from top to bottom in a circular motion. So then we can do it on the other side as well. After that, we determine the long axis of the feet, where the long axis of the fetus is located. And then after that, of course, we check for the fetal's position. We check for the fetal's heart rate. So the normal fetal heart rate normally is from 120 to 160 beats per minute. After doing the second maneuver, we are now ready to do the third maneuver, which is what we call the pole legs maneuver. So on this maneuver, we are going to create a letter L on our fingers using our index finger and of course our thumb. Okay, so the third maneuver is basically used to determine the degree of engagement of the baby or the fetus on the mother's womb. Okay, so we are going to identify the presenting part, and at the same time, we are also going to identify the mobility of the presenting part. Okay, so what we will do is to put our fingers to the lower part of the uterus, and then we will try to move it. Now, if you can feel that this part or the presenting part is movable, then it means that the head is not yet engaged. But if you can feel that the presenting part is immovable, meaning to say that the head of the baby has engaged. Now, if you remember, for the first three maneuvers, we are facing, while doing the procedure, we are facing the mother. But for the fourth procedure, we are going to face the mother's feet. Okay, so by the way, for this fourth maneuver, what we call the pelvic maneuver, we are going to identify the degree of deflection of the fetal's head. Okay, so at least 2 inches from the inguinal part, we will try to palpate the mother's midline, okay, using our first 3 fingers. We apply pressure downward and in the direction of the birth canal. And then we try to confirm the presenting part. Now, after doing the procedure, of course, we make sure that we position the patient comfortably. Thank you, ma'am. And at the same time, we also do hand washing. And lastly, we notate all the observations we had from the procedure. So that's it for the Leopold's maneuver. Thank you so much for watching and have a great day all. Thank you.